afternoon. This is Dvora Entin. I'm here with Jake Anderson, and I'm so grateful to you to be willing to spend a few minutes with us and talk about your initiative with you and your wife have created, Fertility IQ. I work as a consultant with Yesh Tikva. I'm a licensed clinical social worker, and I specialize in working with the population of individuals and couples who are struggling with infertility, with pregnancy loss, as well as in perinatal mood and anxiety disorders. And I think especially at this time where we're dealing with kind of the resurgence of maybe are we shutting down again because of COVID? What are our clinics going to look like? Our fertility clinics going to look like in a few weeks' time? And I think even coming off of what they've looked like until now, I'm very interested in hearing more about your story, and then maybe we'll get into a couple questions relating specifically to COVID. But why don't we start with you telling me about yourself and your program and how this whole idea got launched?
Yeah, that's great. Thanks for having me. So Dvora, effectively for us, my wife and I, we sort of struggled in the fertility process. We were theoretically on the younger side. We didn't expect to have any issues. We encountered quite a few, went to 3 different clinics, 2 different states, spent a lot of money and a lot of time and emotion in the process. And it really brought the relationship to the brink, if I'm being honest with you. The major issue that we contended with was we just didn't feel like we were getting good, rigorous, reliable information that was commensurate with the cost and the seriousness of the subject. We just felt like we were making snap judgment, life-altering decisions without good information. And so we left our jobs to build Fertility IQ. We have really one remit, which is to get people reliable information. We have 2 products. You can come to us and read assessments of fertility doctors and clinics in the States, according to people like you. So you could say I'm a Ashkenazi Jewish 40-year-old woman thinking about doing donor egg in New York, and show me reviews written by people like me and what they experienced. So that's one thing, are our assessments. And then the other thing that we do is we have these very detailed, rigorous courses. And so you might say, hey, I'm thinking about doing IUI or IVF. How do I think through the trade-offs of each? Or, my doctor told me to do PGTA testing on my embryos. They came back mosaic. What does that mean? And what do I do from there? And that's really our focus. So assessments and coursework.
And what has been well, first of all, I want to just make kind of like a note in that conversation about like brought my relationship to the brink. I think that I gotta pause on that for a minute in how kind of prevalent that conversation tends to be between couples, and that we push and we push and we push for fertility, and then the relationship can really struggle. So just acknowledging how universal that experience can be for couples, and how especially the extra strain of I don't know how to figure this thing out on my own. What are some of the things that you're hearing from your clientele, the people that are checking in on and giving reviews about the doctors? What are you hearing as the number 1 or 2 or 3 concerns? And what are the things that are like the most valuable for them to identify? Like, what are they seeking information about?
Yeah, it's a good question. I think, when we hear patients weigh in on their experience with doctors and clinics, I think we hear typically a few things. One is there's just variation in what people want. I think it's really important to realize that there are some people that want their doctor to explain every specific scientific detail and options, and there are others that are ready to abdicate responsibility for those decisions and say, hey, listen, save me the time and the effort, you decide. So I think there's a fair amount of heterogeneity in terms of, what people want from a relationship with the doctor and the detail that's provided. I think one of the things that patients come to appreciate are things that are not clear at the outset. For instance, one I think would be the importance of the laboratory. The laboratory, I think, is very much make or break in the process. You can't change the quality of your eggs and your sperm, but the quality of the laboratory can improve the ability for those embryos once created to improve the odds of a live birth. I think that's something that patients don't realize until they've gotten pretty far into the process and have started to ask piercing questions on that front. I think the other thing that patients come to realize is that no clinic is perfect. No doctor is perfect. We're all human beings. And what that typically means is that there will be trade-offs no matter where you go. There will be, terrific nursing team, maybe less than terrific billing department, and all sorts of different variables. And so I think the thing that's important, what patients come to realize is that, not that I'm trying to find the perfect clinic, but one whose strengths and weaknesses can comport with what works for me. Mm-hmm. And so I think that's a level of texture and nuance that ends up being a bit of a surprise for people in the process. Ultimately, at the end of the day, we do see a fair amount of correlation between whether people felt like they were treated like a number or like a human being, and the odds that they will recommend that clinic to somebody else, regardless of whether they succeeded in treatment.
Mm-hmm. Absolutely. When I think about that laboratory, I think one of the as being a non-medical professional seeking care, what I tend to hear so often is I don't want to make my doctor upset, or I don't want to rock the boat. And I don't know if it's my right to ask some of these questions. And I think that leaves us in a particularly vulnerable state as a patient or as a client. What are some of the ways that you might encourage someone who feels maybe a little bit like vulnerable and to the point where I don't feel comfortable asking some questions? What are some of the ways that you might encourage somebody to do that? And also, what are some of those questions to check in about that lab?
I think that's really important. I think many of us, we want to be respectful of people, and so it can be a ginger and tender thing to ask, very specific questions around quality control and things of that nature. So I understand the need for delicacy. At the same time, I think most fertility patients will tell you this again and again, which is they wish they had become a better advocate for themselves at the outset. Honestly, I hear it so often that I've almost become desensitized to it. But yet I think it's the most true thing in this whole process, which is there's a lot of complexity, and even well-intentioned doctors and clinics can advance past explaining something that's impertinent for you to hear. And so I think at some point you sort of need to say to yourself, this is so important. I need to make sure that I'm coherent on the answers. And so, oftentimes I think just a gentle, hey, listen, know you do things really well around here. I hope you don't mind if I ask a few specific questions because I've got a lot of money and a lot of hope invested in this. I hope you can understand that. And then I think most doctors and clinics, I think once you phrase things in that way are very receptive. I think even if you don't phrase it in the way many are receptive, thereafter, I think the things that one really needs to focus on, not to get too medically, are the key performance indicators around the laboratory. And there's a bunch of that you could focus on. I think from an IVF perspective, this thing called the blast conversion rate, which is how many fertilized eggs lead up to reaching a day 5 blastocyst. I think that, frankly, is kind of the most important, but there are others that are important. Separate and aside from that, there are questions that I think you can pose around when they think it's right to matriculate from one stage to another, from Clomid to IUI, IUI to IVF, IVF with your own eggs to IVF with donor eggs, and how they think through those breakpoints. I think that can be really, really telling about the doctor's thought process. There's some just aspects of clinics that I think are characteristics that we've sort of noticed in time, which is, and again, everything has trade-offs. If you go to an academic medical center, oftentimes those doctors, they're very up on the medicine, and usually they have no economic skin in the game which treatment you choose, which is great. They oftentimes do run a lab. They may be publishing, they may be overseeing fellows, and there's only so many hours in the day. And so I think recognizing that can be a strength and a trade-off. Mm-hmm. I think at at some of the smaller clinics, you'll receive more individualized care, and you'll know your doctor, and your doctor may be up on your profile. And yet sometimes smaller clinics, they don't have the same resources as larger clinics do. And so I think just sort of realizing the profile of you're going to academic versus non-academic, large versus small, I think putting things in those quadrants can be useful.
And how would I assess if you say to me, how many blastocytes, how many blastocysts make it to a lot, to day 5? How do I know if that's a good number, right? Like if I don't know what is a good number, how do I know how to qualify that information?
Yeah, so if somebody responds to you, and how do you characterize, like, should I be encouraged by that, or should I be ambivalent, or should I think about going elsewhere? I will say, even once you get a number from people, sometimes it can be difficult to interpret. If a clinic sees a lot of really hard patients who are possibly on the older side, by virtue of the nature of who they see and rather than the quality of laboratory, you might see different numbers. However, holding that in abeyance for a second, assuming people see generally the same population, like you're looking at, two somewhat similar clinics. There's a society of embryologists that sort of puts out some mile markers and things of that nature. For something like blast conversion rate, if you see something around 50% of fertilized eggs lead to a day 5 blastocyst, that's typically considered pretty encouraging. And if you see something lower than that, there may be a good reason that has nothing to do with the quality of the laboratory, but you might want to punch into that and understand why that'd be the case. So 50%, I think for the most part is generally pretty encouraging.
Okay. And what are you finding? One of the questions I have when people are assessing clinics beyond the lab, I guess, or in addition to the lab, might be the large practices versus that one person in practice. And I guess I always felt like the one person in practice worried me. And is there any truth in that? Like, I want you to be attached to something bigger. What's your sense of that?
Yeah, I think I think one thing to sort of wonder aloud, is there any data that would reveal a larger clinic has higher IVF success rates? That's hard to interpret and disentangle. I've seen data that cuts both ways. I've seen data that makes no conclusion. So, knowing that would be great. I think we put that aside because I think it is pretty hard to say that for sure. The way I think about the larger versus the smaller lab clinics, what we've seen, at least in our data, and it's not peer reviewed and published, but we presented it at ASRM, is if we look at the errors that people experience at a clinic, we see the percentage of errors that they experience go up until a clinic hits about 1,000 IVF cycles per year, in which case we see it actually drop off. Mm-hmm. And I do wonder to some extent whether adding more volume into the system can be painful and create issues up until the point where the place is frankly so hefty it becomes more like a machine. That's all theoretical. But I generally think for the most part, bigger clinics have bigger budgets. They have more money to devote to the laboratory, maybe more resources. I think to the extent that the doctors actually really do convene and discuss hard cases, you get a second set of eyes on your case, which can be reassuring if it's a hard case. However, bigger places means usually more chaos for the most part. And that means you may not see your doctor repeatedly. You may see a nurse repeatedly. Things slip through the cracks. And you can debate whether that is less true at a solo practitioner or where there's frankly fewer moving parts, but also maybe less redundancy. Usually smaller clinics will have 1 or 2 doctors, 1 or 2 embryologists, and things happen in life. To the extent that somebody gets sick with COVID, who knows? You could draw the conclusion that maybe there's less backup in place. So I could argue both ways.
Interesting. So what would you say are the top takeaways from the data that you've been collecting over time? Especially maybe if you were a physician listening to this, if you were a reproductive endocrinologist who happened upon this video and you want to say, listen, this is the top 3 important things that your clients or your patients really are expecting from you. And if you want to be like a top doctor, these are the 3 things that we hear the most from our patients.
Yeah, that's a tough one. I think that the stuff, we had an article published along with the team at Emory in fertility and sterility. So it was subject to peer review. And I think we saw a pretty close correlation between patient satisfaction and a few factors. And again, we isolated out the variable whether somebody succeeded or not, because obviously if somebody succeeds, they're going to be—
They love their doctor.
Yeah, of course. But I think a few things I would say. One is were you treated like a number or like a human being continuum. We definitely see a close correlation between treated like a human being and willingness to recommend that doctor or clinic. We also see pretty tight correlation between whether the doctor adjusted treatment. For me, I think a major hang-up for fertility patients, given that so much IVF doesn't work the first time, is that the doctor seemingly just did the same thing again and expected a different result. And I think patients want to perceive that you've learned from the previous cycle and have made some sort of adjustment. And, I don't know if patients can tell the difference between a 50 international unit dose change for gonadotropin. That may seem like a lot, but in actuality, it may not be that much. But I do think patients, it's important for them to feel as though the doctor is being scrappy and investigative and not just running it back. I would say the billing department matters. It's the billing department, you could argue, may not be the crucible thing that will change your odds of success. But if a patient fails treatment and feels like they got overbilled, that's a hard one for them to choke down. And I think there's a very realistic chance you either lose that business or you lose the ability to have a positive referral. And so those are some of the things from our data that's sort of, jumped out.
Fascinating. Absolutely fascinating. So let's just, as we kind of finish up today, tell me a little bit about what your thoughts are as we move towards kind of this question mark around COVID, around shutdowns, openings. What have you been hearing from the people that are struggling through this really difficult time period?
I think everybody's really struggling. I think obviously patients are struggling, those who are dying to get in and do the retrieval, or those who are ready to do a transfer. Even if those embryos are frozen, it doesn't change the odds of a delay of that they'll get pregnant, but still it's aggravating. And then the doctors and nurses, I think this is unbelievably hard for these people. They're working longer hours than they used to under unusual circumstances. And many times they have their own families at home, older parents, younger kids.
That's true.
And so I would just say that this is just a terrible period for everybody involved. And the things that I think we're hearing from, patients specifically is, I think is questions around, is it safe to go back into a public place? And once I do, how do I feel about being pregnant in this period? And what are the medical implications for me and, God willing, my offspring to have children? And so I think those are the things that weigh on people. I would say for the most part, the survey work that we've done is I think most people have advanced past those concerns and have said, I'm going to do this. I think for a non-insignificant minority, there is a lingering concern over those things. But very few people that we've surveyed have said, this is a showstopper. I'm going to discontinue treatment. Even amidst the economic downdraft of, hey, now even if I, medically am comfortable doing this, can I financially afford it? And I think what we've seen is people are nervous about the economic situation, but they're still very compelled to get into treatment and find the way to pay for it. And the situation's not stopping them.
It's interesting also because if you think about it, like there's this concept of time passing. If there's anybody who feels the clock ticking, it's the people that are going through fertility treatment. And like that idea of like, well, I'll just wait a little bit longer, I'll just push it off. We don't have that luxury when we're sitting in fertility and those struggles. And I think that if anybody gets it, it's this community of individuals of time. Time means a lot to us. And it's a tough idea to put something on pause.
It really is. And, it depends on the type of patient. Some patients, they have a bit more runway and their odds of success can maybe tolerate a delay. For other patients, a few months might be important. And it's tough to know who you are. It doesn't always it does correlate to age, but it's not always lockstep with age or diagnosis. And so I think that's a challenge. I think one of the things that we do lose sight of to some extent is, if you have your embryos frozen, the quality of those embryos will not degrade having to wait for that frozen transfer. And so while waiting to do the transfer is agonizing, truly agonizing, waiting to do the transfer may not weigh on your odds for that transfer to work.
True.
That's different than people who are waiting to have an egg retrieval, where you may be in a different boat. And so I think making that distinction for people to some extent allays a little anxiety.
Yeah.
But maybe not much.
Let me ask you one final question, just because you brought up an idea for me. Like, I'm thinking about people trying to synthesize information that's coming out, in the popular press. And one of the things I work with as a therapist is people, reading that singular case study relating to COVID crosses the placenta, or COVID, the higher risk implications of COVID on a pregnant woman. And like, oh, what do we do with this information? And recognize, if you read the data, it's like one case study, one review of a case of 12 individuals in Europe. It's not significant enough from a research perspective, but that's still enough to cause extraordinary distress in the people that are reading those cases. Are you hearing that from your clientele as well? And how do you address that?
Yeah. Well, one thing I should probably be in a rush to say, and should have said at the outset, obviously, I'm just a random regular person. I'm not a fertility doctor, not medically trained. I'm somewhat better than just a person off the street. But I should just sort of say that should have said that at the outset. Yeah, I think, there's, I think when I look over scientific and medical literature, obviously a lot more credence is paid towards the studies that have a larger sample size, that are more representative. And in the absence of that, sometimes then the focuses on what's known as a case study, individual examples, and they can be to some extent useful. They're certainly more interesting for writers to write about when they write stories, because they want to start with the vignette that makes it real. But it's very easy to over-index on those. And the reality is that's why you need real studies. Unfortunately, in this set of circumstances, you have to have a big number of patients, and then you have to roll it through all the way to pregnancy, and maybe even a year after the child's born. That's going to be
it's a new virus. Right.
Yeah, it's going to be 2 years down the line. And so, I understand the impatience that people have, and yet a lot of these examples wouldn't meet the standards that people have for literature to build a theory on and build a clinical practice upon.
Yeah, and it's just part of the ongoing struggle that I think people are having in these situations with, like, well, who do I know? What do I believe, and where do I get the good information? And so I think what I appreciate the most about your website is that idea of like an accurate place to go to get quality, valuable medical, research-based information, and helps me create a list of questions and guidelines that will help guide other people in their treatment. So thank you for that.
My pleasure. And speaking of COVID, every few weeks we do something new on COVID, where we'll have a reproductive urologist out of University of Utah, reproductive endocrinologist out of Hopkins or Northwestern or UCSF, answering specific questions like this. And, I think one of the refrains that you'll hear is we just aren't sure yet. You'll hear this term reassuring. The data looks reassuring, which is with limited information, we're not scared yet. And
right.
At the same time, we still don't know enough. And
right.
So that's unsatisfying for people to not have something definitive, but at least they're hearing from qualified experts who've reviewed the most recent and useful information to go upon.
Yeah, and I know that ACOG still has made that recommendation that women should not hesitate in proceeding through pregnancy or attempting pregnancy at this time because of COVID, that there is no hesitation on their part. So we go with what we can. So thank you so much for being with us today. I really appreciate it. For further information, check out Fertility IQ, and then you can also check out Yesh, which also will link you there. We're glad that you joined us. If you are seeking support, we have we have support groups for individuals, men and women.